So thank you so much, everyone, for joining us today. We are here to talk about the mind-body connection. We're speaking with a nutritionist, a psychologist, and a pelvic floor PT, which I think, seems kind of hodgepodge, but honestly, it's really the dream team in my opinion, on the way to nourish your body really during pregnancy and postpartum. And the mind-body connection is something that we at Origin talk about a lot. So I'm really excited for this conversation. A quick reminder, just from a housekeeping perspective, we are recording the session and we'll share it out with all of the attendees afterwards. I know we also got a bunch of questions in advance, but please feel free to leave any unanswered questions or open questions. Just insert them into the Q&A box and I'll make sure that our panelists see them and can reply to them. But we will just kick it off. I am Allison Grant and I lead the marketing team here at Origin. A little bit about Origin in case you aren't familiar with us. We are physical therapy for women and mothers, but really our aspiration is a lot bigger than that. We want to empower women to feel strong and good in their bodies at every stage of life. And it's also important to us that this type of care is accessible. So we are in network with most commercial insurance plans. And we actually just opened our third clinic in California this past month in San Francisco in Cal Hollow. And so I think that will be a perfect introduction to today's panelists. So we have Liz Miracle, who's Origin's clinical director and head of clinical quality and talent here in the Bay Area. Some of you might know Liz. She previously ran her own practice, Miracle PT, in San Francisco for 10 years before joining us. And then we also have Allison Bowden, who is a registered dietitian and functional nutritionist, and also the mother of 2 boys. So definitely can relate to all of you postpartum moms out there. And she's the founder of Nourishing Radiance, where she really specializes in helping moms recover and replenish during those first postpartum years with a food as medicine approach to health. And last but not least, we have Dr. Nina Kaiser, who specializes in teaching mindfulness and cognitive behavioral strategies, helpful in coping with anxiety, stress, and emotions. She was previously at UCSF before opening her own private practice, and now she runs the team of clinicians at Practice San Francisco. She was just telling us about her new Mill Valley location that they're opening, so excited to hear more about that. But they really focus on educational programs, group support, and individual therapy for children, teens, parents, and parents-to-be. And so with that, I will turn it over to Liz to kick off our discussion on really the mind-body connection and what that means.
Thanks, Allison. So we can kind of start with what the slide says here and get a little bit deeper into it. But the bottom line there that says TLDR, which I did not know what that meant for a really long time. Somebody had to tell me that that meant too long, didn't read, is that we really need to listen and trust our bodies and what our bodies are telling our minds. And I think that sometimes in the postpartum period, that can be really difficult for us to even really understand what's happening in our bodies. And a lot of that really comes back to the fact that there's been a lot of misinformation around research and what's actually happening for women. A lot of that research that's done on how pain is experienced, et cetera, depression, anxiety is done on men, even though women are often more affected by that. So that doesn't really give us a true understanding of what's happening for women. And a lot of women don't even have the right words to describe what's happening in their body. So they don't even have a framework to start with to be able to come to the table with descriptions of what's going on. I'll give a recent example of something that happened to me. I had gone one day without eating lunch, like as many moms do. And I was busy, gone to bed that night. In the middle of the night, I had a lot of abdominal pain. And so I thought, oh, I'm hungry because I skipped lunch. Maybe I didn't eat enough for dinner. I should get up and go eat something else. So I got up and went to the fridge and got a little nibble, and then realized it wasn't actually hunger. I had started my period. So the pain that I was experiencing was it was based on what my mental context was telling me regarding what had happened to me that day, and not necessarily what my own sensations in my body are. So any other day, if you would tell me that I would mistake hunger for period pain, I would say you're crazy, because I know what those two things feel like, and that I wouldn't do that. But I did do that very recently, like a few weeks ago. And so part of what, and I think that when we have experiences like that, it teaches us not to trust our own body, and it becomes really difficult. So part of what we want to do in physical therapy, and I'm sure Nina is going to speak a lot to this, is to help you start to listen and get in touch with your body and what those sensations are, so that you can describe them and you can report them back. And we also are here to kind of guide you through the early transition in the postpartum period when it comes to getting back to physical activity. So making sure that you're listening to your body, especially in the first 3 months. Things like walking, gentle yoga are great. Body weight exercise, like where you're not using a lot of weights yet, but strength training with body weight exercise can be good once you've been cleared by your doctor, your midwife, and you feel ready. So just because you've been cleared doesn't necessarily mean that you're ready. If something doesn't feel right, back off, ask more questions, get professional help. Don't just dive into it. And also do come into it slowly. So just because you're a marathon runner, you've been through a really big experience with pregnancy, regardless of the mode of delivery, and you need to honor that and dive back into whatever you're doing, jump into whatever you're doing going forward, with an awareness that maybe you need to do it a little bit slower. A lot of people really focus on trying to lose weight in that period of time. And I will tell you that the best way to lose weight, and just in case people are out here wanting to know that answer, is through high intensity interval training. That's not something that you want to do in the early days, and you need to be strong and you need to be ready to do that. If you're looking for some tips on exercises that you can do in those early days, you could just do really simple things like getting on your hands and knees and trying to draw the abdomen in while playing with your baby, engaging with your baby, making it a positive experience, or trying to tighten and release the pelvic floor, maybe while you're feeding your baby. The one thing I will say is that, I'm just coming back to the weight thing, because I know that Allison's going to be talking about nutrition here in a little bit, and nourishing yourself, is that losing weight can be helpful for the pelvic floor muscles, because those muscles are supporting the organs, or supporting weight. So if you take weight off of the pelvic floor muscles, they tend to function better, right? They're not going to be straining as much, causing pain, and they're not going to be trying to lift as much to help support you, keep you from leaking urine. But you don't have to jump right into those high intensity impact exercises. You can start with low impact exercise and pelvic floor strengthening in the meantime, until your body is ready to kind of ramp up and do that. So that's kind of the short version around pelvic floor physical therapy. If there are questions, I would love to answer them, but just basically take care of yourself in the early periods. And then I might interject every now and then while Allison and Nina are talking, but I feel like a lot of what I would want to say, which is around nutrition, would be about making sure that the food is high in fiber so you can have poops. So I know that Allison's going to talk about that, and making sure that you drink enough water, because sometimes women will reduce their water intake to keep from leaking urine. And that's not great if you're producing breast milk. And then it causes dehydration, and it actually can lead to more problems with your bladder than if you were to actually keep your water intake up. So with that, I will hand it over to Allison and let her give us the skinny on maybe not being so skinny. We'll see what she has to say.
Yeah, definitely. I appreciate that you said that you want to work on the foundations in terms of movement and the structural programming of your body before jumping into weight reduction techniques with exercise, because that's really what nutrition is about as well. And it doesn't have to be mutually exclusive. Feeding yourself to recover, feeding yourself to feel really good, and weight loss, both of those things can happen simultaneously. So it doesn't need to be either I want to focus on eating for weight loss, or I want to focus on eating to feel good and feel nourished. Those things happen at the same time for the majority of people. So I want to talk about a term that I call motherhood depletion, which I consider kind of a trifecta of things that happen in the postpartum period. I personally define postpartum as up to 3 years post baby, because it takes about that long for your nutrients to replenish after having a kid. And it also takes about that long, maybe a little bit less, depending on what your lifestyle looks like and what your diet looks like, when you to get your hormones back into business, basically, and regain fertility. So when I talk about the concept of motherhood depletion, I'm really talking about the depletion of a few different things. The postpartum hormonal changes, which I'll talk about in detail on the next slide. Postpartum nutrient depletions, which are quite significant, and something that not a whole lot of physicians are testing for, and is actually a cause or a contributor of a lot of our postpartum postpartum symptoms and motherhood symptoms that we often blame on just being a mom and just being a mom of little ones and just being tired. A lot of that is related to significant nutrient deficiencies. And then we'll talk a little bit about eating for blood sugar balance, because that becomes really foundational as well as far as feeling good and feeling energized. So first, let's talk about postpartum hormone balance, something that a lot of people want to talk about. I often get a lot of questions about hormones in the postpartum period. I work with many different hormone issues in my practice. I work with fertility. I work with the hormone connection to weight management, and I spend the majority of my time working with postpartum women on hormone balance. And so just to give you a little visual, and Allison, thank you for finding this or making this graph. This is absolutely perfect. Thank you for making this slide for me. When we're pregnant, at the very end of pregnancy in the third trimester, you can see that these hormones, this is just estrogen, but it's really estrogen and progesterone that do this, that are coming way up to support your pregnancy. And by the time you're in the third trimester, getting ready to deliver, your hormones, estrogen and progesterone, are at their peak. And then you give birth, to baby and birth to placenta, and those hormones go down within 7 days to menopause levels. So that is the most rapid and significant hormone change that any human can experience. It's well documented. And this hormone change, not a lot of people even are aware of. Most people, when they didn't know that beforehand, and I bring this up, they have big aha moments in their eyes, I can tell, because they're like, oh, well, that explains a lot, or why I felt that way. And so that big hormone shift is going to bring with it a lot of symptoms. So, most of us that have had babies felt the night sweats and the hot flashes in early postpartum. We definitely see a link between mood disorders in this hormone shift. Typically we link low estrogen with more depressive type symptoms and low progesterone with more anxiety type symptoms. There's also a ton of environmental inputs for those as well, but this is some of the biological reasons behind them. And so that big shift needs to be supported with food so that we can bring those hormones back up, work with your body to bring it up over the course of the next year or so. So along with that, Allison can actually go back. Along with that big shift, we also see that cortisol, the stress hormone, can kind of go up and down and sideways. The lack of sleep, just big stressors of having a baby, becoming a mother, or adding to your family, obviously is quite stressful. And not even to mention doing all that in a global pandemic, like we've all been doing for the past million years, something like that. And so we see a lot of these hormone fluctuations that can contribute to the way that we're feeling. So I mentioned some of the symptoms here: hot flashes, mood changes, already mentioned, stress intolerance. And we even see things like physical things like joint pain related to these hormone changes, insomnia, weight retention. All of these are related to this big hormone shift. So we want to eat in a way that supports these hormones coming back to balance, and giving our body the building blocks that we need for that to happen in a timely fashion. Go ahead.
Allison, can I ask you a question? I know you want to talk about the postnatal nutrient depletion. Mm-hmm. I have patients who will often ask me what the best way to eat is for building muscle when they're just trying to strengthen their pelvic floor or their abdomen. So I just wanted to throw that in there because you were talking about eating for what you're doing. So just throwing that in there at any point, if that feels like something that you could speak to as well.
I have a slide in here about kind of like a day in the life, what to eat for like breakfast.
Oh, perfect.
So I think that'll be, I think it'll be the perfect, basically getting enough protein and enough carbohydrates is what we need to build muscle. So we want to make sure that we're timing that right, and having the right balance of meals. So yeah, definitely hit on that.
Thanks.
And then along with these hormone changes that happen, which are pretty dramatic, we also have very well documented that most, if not all, women come out of pregnancy depleted in at least a few nutrients. And it's counterintuitive because during pregnancy, we grow, right? We grow physically bigger, and typically our connection, what we think of with nutrient status, whether or not we're fully nourished or we have nutrient deficiencies, oftentimes we think about it as related to our weight. Like if we gain weight, we're kind of overnourished. And when we lose weight, we can become undernourished. But the thing is that even though we're growing physically bigger in pregnancy, and most people are taking a prenatal during that time, that those extra nutrients really are just enough to go to baby and have a healthy baby, for delivery. And they don't necessarily cover all of the needs of mom. And mom can get really depleted, not only through pregnancy, but a lot of people don't know that our nutrient needs postpartum, particularly if breastfeeding, but definitely at least in the 4th trimester, are actually higher than during pregnancy. And when we maybe don't know that, or don't get the education around that, and don't get the support around that, we can really continue that depletion when we're skipping meals, trying to focus on weight loss, and then add in stress and sleep deprivation, which further depletes vitamins and minerals. I work with a lot of women that don't come to see me until maybe 14, 15 months postpartum, and they've been struggling with these really long established nutrient deficiencies from all of this. And when we look at kind of culturally how we treat pregnancy versus postpartum, like pregnancy, we're asking like, oh, are you eating enough? Are you getting your extra calories? Like, are you resting enough? Lots of attention on the health and well-being and nutrition of mom, lots of nutrition information with pregnancy. But then as soon as the baby's out, shift to focusing on the baby, and not to mom's recovery and mom's nutrition. And so I see that is really like the perfect storm of setting up a lot of moms for these symptoms that we just think are ubiquitous and part of new motherhood, that are really symptoms of nutrient deficiencies or combination of nutrient deficiencies and these hormone changes. So that kind of in a nutshell are like the two kind of like big causal factors that I see, nutrition related at least, that tend to lead to some of the trouble that a lot of my mom patients experience. And when we address both of these at the same time, the hormone changes and trying to boost up progesterone and estrogen as much as we can, while really like filling in those gaps of nutrient deficiencies, that's when people start to feel better pretty fast in terms of brain fog and energy, and even sometimes some mood changes.
I was just going to ask if that goes, if it's just like across the board, everything gets better, because I'm like, oh yeah, hair loss for sure. I had so many friends complain about hair loss. Yeah. I've struggled with anxiety myself. I see that a lot in my patients. And are there diets focused toward particular goals, or is it just like really you have to get yourself out of depletion, and then once you do, across the board, these things tend to improve
a little bit of both, and some of these things there's not necessarily like one single cause of them, particularly the mental health and mood change ones. My perspective on these are like, okay, there's definitely like biological causes for hair loss, for anxiety. And my lens of looking at the body and looking at recovery is what can we do to work on that and balance that, while at the same time meeting with somebody like Nina to help get at more of the environmental pieces of that and work on that from her discipline. And so hair loss being an example, 4 months postpartum is when we have a typical postpartum shed, right? And that largely is hormonal, and based on the fact that we don't lose much hair during pregnancy. The hair shaft life cycle has a really specific timeline, and around 4 months postpartum is when your body's going to kind of start to release those hair follicles. So there's a range of normal there that is typical and expected. But if we also have a really severe iron deficiency, if we're also in a protein deficiency, if we're also really, really stressed out or have other mineral deficiencies like zinc, then that hair loss can get a lot worse. We can see that we don't get the regrowth on time, which is part of that process. We get like the loss and then the regrowth. Like if anybody experienced that, all of a sudden you have like bangs. you didn't cut bangs, but you all of a sudden have bangs because it's growing in right there. So some of these things we see can be like biologically normal, but then worsened with nutrition. So, but to answer your question more specifically, I do find like I have an online program called Radiant Mama that goes through in like a really sequential order how to renourish, first from like a macronutrient level, then a micronutrient level, and then hormones. And I would say a lot of women, even just from hitting up the foundations and doing the right meals at the right time, have a really significant change across the board in a lot of different symptoms. And then as we kind of like hone in on more particular issues, then, you know, it becomes a little bit more like a choose your own adventure book where you kind of go off to here based on your symptoms or over here. But I would say the reports that I get from the women in our program that have like some of the most significant changes to how they feel, it's just from like the foundational stuff where we're like eating proper meals, and that by itself and the blood sugar regulation and getting enough calories and enough protein helps a lot of people across the board. Did that answer your question? I went like way off the deep end with.
No, that was great. I love more information than less, always.
Okay, I'm always good for that. So those are like the general kind of like foundational stuff that I recommend here. You know, some of this seems way too simple, but like I'm all about that. What is the laziest way we can make changes so that we can feel good? And I feel like that I come by lazy really naturally, so that most of my programs and the way that I interact with people are like, what was the easiest thing we can do with the biggest impact? And that's really right here. So the first thing we want to do is focus on blood sugar balance and getting enough and a balance of macronutrients throughout the day. And for the vast majority, like almost like 100% of the moms I work with are not eating enough in the first half of the day. Liz, you just mentioned you skipped lunch the other day. So you are a great example of that.
Well, I wanted to point out too, this whole bit about the larger meals and the big breakfast in the morning is also really good for your, like the cycle of your bowel movements. So if you don't have a big breakfast in the morning, that might not trigger your gastrocolic reflex, which tells you to go have a poop. And if you're eating tiny little meals throughout the day, you might not be getting kind of enough of a load on the colon all at once to like get the urge to go have a bowel movement. So I'll work with people on timing their bowel movements based on when they're eating and how they're eating. But a big breakfast in the morning is and some movement is really helpful for that. So I loved that was in your slide.
Yeah, definitely. And I find that like the typical person I work with is having a really small breakfast or even skipping breakfast and then grazing for lunch. Like, you know, I see this with both my like working outside the home moms and my stay-at-home moms or my work from home moms, you know, with so many different flavors of moms that we work with, right? That like, you know, eating like little bits of maybe what the kids are eating or having like little mini meals and snacks over a period of hours. And then hit an energy wall at like 3 p.m., want a cookie or a coffee or both, and then have a really big dinner. And that's the typical pattern that I see. And even just like pushing some of those calories from like the big dinner and the nighttime snacking earlier in the day, it's really what our bodies are made for. And our eating follows the same kind of cyclical pattern as like our circadian rhythm. And so eating more earlier in the day really sets the stage for blood sugar balance and just like feeding ourselves to feel good and have energy balance. So this is one of the biggest things that impacts somebody who's like having extreme exhaustion and fatigue and just like hitting a wall in the early afternoon. Eating a nice big breakfast and a nice big lunch is really, really helpful. Again, like simple, not super like rocket science necessarily, but it can be really helpful. So I have just a couple of examples here of like what breakfast can look like. You know, oatmeal with like nut butter, maybe even some like low sugar granola and some fruit. I also like to put in coconut butter into my oatmeal, and it's delicious, not coconut oil, but coconut butter. Like look it up. It's at the grocery store if you've never heard of that. It's really good. It's like like if you took dried coconut and just blended it. Eggs with toasted avocado is another thing. Sometimes I have something that looks like that for lunch instead. But nice, big, filling breakfast. And then lunch and dinner, we just want to follow a formula. And that formula is like a normal, like grown-up size plate. And we divide it like equally into thirds. And we have 3 sections. And one section, we have like a slow starch. So things like sweet potato, butternut squash, brown rice, those kinds of things, even a white roasted potato is great there. A cooked vegetable. Cooked vegetables are a little bit easier to digest. So when we're trying to replenish nutrients, cooked is just easier on the system. And then the other section would be protein. Animal protein is my preference, but there's more like minerals and more amino acids for building blocks of this recovery and replenishing. And you can really kind of like plug and play whatever your favorites are for all of those. I don't have like super fancy meal plans that I put people on. It's really just like, here's the formula. And then, you know, depending on what somebody's deficient in, we focus on maybe this type of vegetable or this type of protein over another, but really just starting with this foundation of the formula, big breakfast that we want to get some slow starch, we want to get some protein or fat in there. And then this formula for lunch and dinner can go a really long way in how somebody feels. And it's pretty simple.
And I just want to add in too that the cooked vegetables are also important for bloating. So we have a lot of women who are trying to kind of get the abs tighter and feeling like they have more abdominal support for lifting their car seat and child that weighs, 30 pounds. And so the bloating and the way that feels to them is really uncomfortable. So cooking the vegetables can help with that. So just a little shout out to that as well.
Yeah, definitely. And when I'm working with GI clients with digestive stuff going on, I really am focusing on the cooked vegetables rather than like a lot of salads or kind of big voluminous but not cooked vegetables. They're harder to break down. The fiber is more bound and not broken down, and your body doesn't digest it as easily. And then the last things here, and this can go in different directions, kind of based on what somebody's experiencing hormonally and what kinds of signs or labs we have for nutrient deficiencies. But we want to supplement for deficiencies, which it includes continuing to take a multivitamin or prenatal, at least the first year postpartum, continue to take a prenatal, and then longer if you're nursing and nursing past that first year. And then we want to get checked out for some different deficiencies. Some things we just need some labs for. Iron deficiency, really, really common, really, really underdiagnosed and undertreated. And we want to get some labs before supplementing with that, though, because it's one of those things like a Goldilocks situation. We want enough, but not over supplementing. So we want to just get some data there to know if you should be supplementing or not. And I put in there, you want to check ferritin specifically. So like a full iron panel with ferritin to understand what's going on with your iron, not just a CBC, which is the more standard thing to check there. Another really common nutrient deficiency is a magnesium deficiency. I see that related to insomnia, anxiety, anything that's magnesium is an electrolyte that's involved in the relaxation pathway. So anything that either physically or metaphorically feels tight or wound up. Constipation is a tight process, right? Liz has probably dealt with that.
I was just going to say, I want to bring it back to poop again, because I'm always recommending magnesium for people who are having trouble with constipation.
100%.
And then also the fact that you were outlining, like, make sure you get your ferritin tested, because if you're taking too much iron and you don't need it, that can cause you to have more constipation. So yeah, lots of
all comes down to poop today. In the end. It's the moral of the story that everything comes down to poop. I love that book, like everyone poops, like everything's about poop.
I got that book.
Yeah, we all do. So some signs and symptoms of iron deficiency, a lot of women go into pregnancy already deficient in iron. And then again, I don't think the proper checks are run to keep us iron replete for the most part. So it's really common: fatigue, brain fog. It's associated with depression as well. And what else is associated with iron deficiency? Pale skin. So if somebody usually like kind of tans in the summer, with beautiful beautiful summer in San Francisco here, or all of a sudden just like seems a little bit more pale, that can be a sign of iron deficiency because we're just like not getting the oxygen to the tissues. And then magnesium, like I said, anything kind of related to kind of tension or tight, which can be also like cramps, calf cramps, menstrual cramps, insomnia. I've had some good success with using magnesium in mild cases of anxiety as well. So that's a decent one to try. And you could take it before bedtime because it can help relax you.
Is there a type of magnesium that you recommend? I listened to a podcast recently where they were talking about the different types of magnesium.
Yeah, generally I'm doing either glycinate or citrate. Glycinate is great because a lot of people are also deficient in the amino acid glycine. And so taking magnesium glycinate is a great one. For constipation, citrate I like better. It can activate the bowels a little bit better than the glycine does. So usually one of those two are what I'm using. There's a whole bunch of different ones. I usually just kind of err on one of those two for people rather than getting too technical with it, but usually they do that good on one of those. And then a couple of functional foods for hormonal support I put in there. Ground flaxseed, really great for estrogen support. I've found that to be really helpful at eliminating or reducing those hot flashes or night sweats, especially early on in postpartum. A nice whole soy product, organic soy product, can also be really helpful at bringing that estrogen back up. Sweet potato and maca I really like for helping support progesterone. Eating sweet potatoes, eating oats are great for progesterone. And then maca is a powder. It's a root vegetable from Peru that's shown to be adaptogenic, so it can help different types of hormones and help your hormones adapt, especially during hormonal transitions like postpartum. And you can buy like a powdered form to add in your oatmeal, for example. So those are my foundation stuff there.
Oatmeal is good for breastfeeding too, right?
Yeah, it's like a
nuts.
Oatmeal, flax are actually both great. Dates. And then like herbs are great for that too. But yeah, I really like oatmeal and flax for breastfeeding as well. And then I also want you to sleep as much as you can, because if you're not sleeping, that's one of like the biggest biological stressors you could have in your body. And of course, in the newborn stage, nobody's getting any sleep, but even no matter what your kids are up to with sleep, my youngest is 4 and still has sleep trouble. No matter what's going on with your kids and sleeping, if you could even just get like 30 more minutes, go to bed 30 minutes earlier, that can have a really tremendous impact on how you're feeling, and your cortisol and your hormones coming back up to balance. So even if you can just get like 20, 30 more minutes than what you're doing now, unless you're getting like 8 now, which, hooray for you if you're getting 8 now, always getting a little bit more is always going to help. So that's it.
Great. And with that, I'll turn it over to you, Nina, to talk through some of these pieces.
Yeah, that sounds good. So, Allison, I love the way that you're outlining all of the hormonal and nutrient shifts that can happen post-baby, because there's so much there, and this panel in general, all of this is intertwined, right? Your physical well-being, your nutritional well-being, your emotional well-being, right? And these same hormonal processes can underlie changes in your mental health too. Difficulty postpartum emotionally, whether with depression or anxiety, is incredibly common. 1 out of 7 women have the experience of postpartum depression at some point in the year after they give birth. For many women, that is, within the first 6 to 8 weeks. And there usually is a second wave that happens around the time that women go back to work. So around the 4 to 6 month mark. So it's important to keep in mind and kind of be monitoring your well-being over the course of time. Like Allison was saying, that now our understanding of what counts as postpartum is 3 years after your baby is born, right? So I have a 2-year-old, technically still within that window, right? And so it's important to be attentive to your well-being on all of these fronts over the course of a longer period of time than we might think of as being typically postpartum, right? during that time, there are a lot of changes neurologically that are happening for you, right? Your neurons, your brain is actually changing in response to having a baby. Really interesting research on this idea of synaptic pruning, which is kind of this phenomenon, the ways in which the neural pathways actually are shifting and changing in your brain as a result of having a baby. There are good things about that, right? That you're learning new skills, you're engaging with the world in a really different way, and it's challenging. Hormonal changes, like Allison outlined a few moments ago, also relate to your mood, to your well-being, and kind of how you are able to show up cognitively and mentally. Plus the sleep deprivation, the fatigue, it can have an impact on your emotional well-being too. And Allison has on the slide also your sexual desire, right? And kind of how you show up in that kind of way. But even more than that, just in terms of your emotions, right? When we think about foundational self-care to support, improved mood, decreased anxiety, some of the first things that we think about are like, what does your sleep look like? What does your nutrition look like? What does your physical health look like, right? And so here, postpartum, you're in a situation where all of those things are impacted. You're probably getting a lot less sleep and rest. Your nutrition is, maybe sporadic or inconsistent. You're depleted anyway. And in terms of physical health, you're recovering from childbirth. Before I had my older son, someone told me that childbirth is like getting into a car accident with someone that you don't know. And then afterwards, you're recovering and you're taking care of this person that you don't know who's also recovering, right? And so, there are all of these things that are going into the mix and impacting your emotional well-being postpartum too. Pretty much everyone has some experience of what we call the baby blues, which are subclinical, but still kind of challenging. Variability in emotion and waves of feeling overwhelmed or sad. Perinatal mood and anxiety disorders are where those kind of feelings of depression, of anxiety really interfere with your ability to be present with your child or present in your everyday life. But emotional well-being in general can be really tough post-baby. And whether you're having, what we think of as more standard or typical baby blues, whether you're having a more clinically significant experience of depression and anxiety, finding a support is really important. Talk therapy in particular, our team does largely what's called cognitive behavioral therapy, which is an evidence-based treatment for mood and anxiety. But basically, you're talking with someone about what's going on. You're problem solving about the things that are hard. You're looking at what can you do to shift how you feel in the moment? How can you shift the way in which you think about things and the way in which you cope with things? So all of those things are helpful. Your mental health, and I maybe will let Liz speak to this too, but obviously your mental health impacts how you show up to the table in your sexual relationship too. You've just had this huge hormonal shift that impacts how you feel. Your interest is probably lower anyway, because you're potentially, I think a lot of moms have this experience of feeling touched out. You've got somebody attached to your body 24/7. The last thing that you want is someone else touching your body. You're tired, you're overwhelmed, you and your partner might be fighting or arguing about what's going on for your baby or your infant in a way that also tends not to improve your sex life in those moments. So, and the more significant the challenges that you're having with anxiety, with depression, the more likely you are to have decreases in the interest that you have or how often you actually engage in sex with your partner over the course of that postpartum period. And there's a bi-directional relationship there too, that the more sexual problems you're having, the more likely you are to have an increase in depression, because you're feeling disconnected from your partner, disconnected from your body. Like Liz is saying, that awareness of what's going on internally is really an important part of the picture here.
I think there's also a lot of fear around the body and what's happened, especially when we're not educated around it, and let's say you have a C-section scar that's healing and you can't feel your lower abdomen anymore. Like you physically can't feel it because those sensory nerves have been cut and they're taking time to heal back, and it takes nerves a long time to grow back. And for some people, some of that sensation never fully returns. And being able to feel their body and to touch their body and feel their body is wrapped up in their sensuality. So it doesn't just have to be a vaginal birth that can lead to sexual issues. It can be a cesarean birth. I often have people who have painful penetrative intercourse who had a cesarean birth and not a vaginal birth, and they're still having issues. We did a talk very recently about exercise, postpartum exercise. And one of the questions that we got in that talk was about how long can I expect for my sexual desire to be low after having a baby? And maybe I'll punt that back to you, Nina, but it was like, it can vary so much and on so many different factors. I get that question a lot in clinic, and it's very hard for me to answer because it has so much more to do with them as a whole person than just, did the tear in the perineum heal, or, are the hormones back in sync? So you maybe now you no longer have that estrogen depletion at the vulva that causes that dryness and rawness. It's so much bigger than that.
Absolutely. No, I think you're right that there's not one single answer that's going to cover everyone on that front, right? It's a question of thinking globally about all of these factors and where can we continue, that if you're not feeling it, like where can we continue to push or support you, right? In shifting what's going on for you, whether it's physically, whether it's nutritionally, whether it's emotionally, right? And emotionally for you personally, or in the context of your intimate relationship with your partner too. Yeah, absolutely. Breastfeeding also tends to have an impact on your mental health, right? Allison was talking about the hormonal shifts that happen. Those shifts and changes happen at different times, but also are impacted by breastfeeding, right? Your physical state is impacted by the hormonal changes that are happening. As you're breastfeeding, your breast might be more sensitive, right? In a way that also impacts how interested you are in sex, how much you want your partner to be touching you. Elevated prolactin levels can result in decreased production of both androgens and estrogen in a way that also impacts your physical responsivity. There are some potential upsides there though. Oxytocin release, oxytocin is the chemical, the hormone that allows us to bond, to experience feelings of love. And so those, hormones that are releasing as we interact with our infant can improve our mood, also can contribute to sexual arousal too in those moments. So, the hormone impact is not all in the direction of things being challenging. Now, as we're thinking about how to support our own postpartum mental health or well-being, I mean, those of you who are here today are a couple steps ahead, whether you're still pregnant, whether you're in that postpartum phase, as you're thinking about this with some intention, right? As the starting point, you're addressing foundational self-care, like we've talked about before, the needs for sleep, for nutrition, for physical health. But I also want to encourage you, to kind of keep a couple of other things in mind as you think about your postpartum mental health and think about prioritizing that. The first of those would be to expect to find yourself out of your comfort zone, right? You're transitioning into an entirely new role in your life, the role of motherhood. And so you're not going to know how everything goes, right? You're not going to know if you're doing things right or wrong. The only feedback that you have is kind of how your baby is doing on a day-by-day basis. And a lot of it is going to feel unfamiliar and uncomfortable. And that's okay, right? That's the way that developing your ability within any new role or any new skill tends to be, right? That it's uncomfortable, that we mess up, we learn by doing. And so that's part of the process here. Part of how to, I should be explicit here, then part of being successful and being mentally healthy is setting that expectation, right? That this is, if it's not like all sunshine and roses going into motherhood, that is okay. And that is the way that it is for, I would say everyone, maybe not all of the time, right? But the beautiful pictures of new motherhood that you see on Instagram, there are those, and everyone has these moments of feeling overwhelmed, feeling like they don't know what the hell they're doing, right? And that's okay. That's part of the picture for everyone. So when you get to those moments, like, hey, this is part of the deal. finding and leaning on community also is really critical. Connections with other new moms can help make it clear to us that this stuff is really hard and that everybody is struggling, right? No matter what you're seeing on Instagram. Plus, your friends are really great sources of support during the tough moments. I've got 2 kids, a 4-year-old and a 2-year-old. And when my 4-year-old was born, I had a whole crew of moms that we were texting each other at like 2 a.m. being like, I'm up breastfeeding. The baby is still crying. What can we do? Right?
A different kind of you up text.
Oh, totally. Right. Totally. That's so supportive, right? And you don't feel as alone. You're like one of other people who are up in the middle of the night. Right.
Well, can I ask you a question, Nina, about that, about finding and leaning on your people? Because I feel like COVID has just been so terrible, terrible for that. And I know we're kind of coming out of it now, and I know that you lead groups. Do you have online groups for people? Are these postpartum groups? Like what kind of things do you have to offer at your practice that could help in that way?
Yeah, no, I really appreciate that, Liz. We have a weekly new mom group on Tuesdays with a perinatal psychologist. This is part of the purpose, right? It's just people coming together, connecting, building their community. This is actually the core reason that we started perinatal services in the first place, was that, my own experience of motherhood is that community is so critical, that looking for ways to offer that to other moms. Right now, that new mom group is the only thing that we have actively running in normal non-COVID times, and we may resume this over the summer too. We usually also have a weekly prenatal support group and also pre and postnatal yoga and fitness classes, again, with the primary purpose of building community.
That's
we usually do.
Oh,
totally. I know, but it's not all in action.
I feel like that's all we have. I'm like, no, that's a lot.
I know, right? We usually do like a monthly open house too, and kind of mom's night that hopefully also will be back in action this fall.
And if I may plug the benefits of a mom's group like that, because when I had my first baby, 6 and a 4-year-old, I was the first one of my friend crew to have a baby. And so I didn't have that already built in. And I went and did a mommy and me class facilitated by a perinatal mental health professional. And I am still in contact with that crew there. Our kids are all turning 6 this summer. And so that, you don't have to already have that built into like what, your friends group or whatever before, but sometimes going and paying a little bit for your mom crew can be really helpful. Yeah.
So no, such a good point, Allison. Yeah. And I mean, that was true for me too. I had one friend who had a baby around the same time that I did, and everybody else I met through a mom's group here in Marin where we live. So absolutely, I would love it if people wanted to join us for our Tuesday group. Is fantastic. I think it's a $10 drop-in week by week, Tuesdays 11 to 12. We also, there are a lot of local moms groups that are great, like Golden Gate Mothers Group, Southern Marin Mothers Group. I'm sure there are parallel ones down in LA. Other places like Recess, Natural Resources, Kinspace, right? There are a lot of really wonderful resources. And we actually have a resource list, I believe, posted on our website. If not, you're welcome to email us at info@practicesanfrancisco.com. We can send that out to you too, just because, we feel really strongly, we want to build our community, but also feel really strongly that community is so important. We want moms to be able to access that in whatever way works best for them. So I should say too, our Tuesday group right now is fully on Zoom. So we welcome moms participating from anywhere. So yeah, just a couple of other things here too. I'm going to encourage you to embrace radical acceptance. And what I mean by that is like, this is what it happened. It is what it is, right? So when things happen that are challenging or embarrassing, or you're like, this didn't go right, I completely messed up. Like, it is what it is, right? It happened. Let's figure out how we can move on here. The only constant to motherhood is change, right? Kids change over the course of time, and knowing and being grounded in this moment and knowing that it's just this moment, right? These things change, they shift, they pass. With my older son, I remember sitting in the rocker. We had one night, a couple nights after we came home from the hospital, that was just miserable. He was crying for hours, could not get him to settle, right? I was like, oh my God, is this what my life is at this point? And of course it wasn't, right? It was like one night. I think this is why second time motherhood tends to be easier emotionally, not always, but often, right? Because you know that crazy, challenging things happen and they all inevitably pass, right? Your kid is going to come to the table in a different way the next day, the next week, and you'll come to the table in a different space too. Right. So as you're
I'm going to say the
things,
same thing
yeah,
for physical things too. You know, I think sometimes you'll be in that moment where you're just straight up like out for coffee with your friends and you just totally pee yourself and totally soak your pants. And it's like the worst thing that could possibly ever happen. And you're like, oh my God, this is my life right now. It doesn't have to be, right? And it is just that moment. And I think that we do get fixated a lot on that, like that cyclical thinking. So I'm really glad that you brought that up.
Yeah, absolutely. Right. All of this shifts and changes, and there are ways that we can tackle and address challenges as they come up. Yeah. As you're doing that, it's really important to find ways to take breaks and space for yourself as a parent, right? I know a lot of first-time moms in particular can be reluctant to, kind of, let's say, take a shower, right? Plant the baby in a baby seat and take a shower. Well, even if they're crying, that's okay, right? Leave them in the crib while you take a shower. Like, it's not going to hurt them to be on their own in a safe space for a short period of time. If you need space, similarly, fine. Step outside for a moment, put on noise canceling headphones while you take a few deep breaths in another room, right? Because parenthood is hard. Like your kids' cries are emotionally triggering, right? And giving yourself some space and a break from that is really important. Obviously, if you have a co-parent, taking advantage of that, trading off where you can, right? To get that space or break. Getting out of the house is important too, right? Even if it feels overwhelming, which it probably will at the beginning, the only way it gets easier is by actually doing it. A little bit of fresh air can go a long way, and you build your confidence as you do those things too, right? And your comfort level with motherhood and your new role. It's also helpful to try to maintain some kind of connection to your pre-baby self, because here you are in a role that's brand new, right? Can be completely consuming, especially at the beginning. And it's helpful to remember who you are outside of being a mom. Pre-baby you is still under there, even if you're feeling completely consumed by new motherhood, and finding something that can help remind you of that you still are you, even in the context of this new role, is helpful, even if that thing doesn't look exactly like it did pre-baby. Right. So, I know one of the psychologists on our team is obsessed with traveling, with Italy. She used to, love to travel pre-kids, and after kids, she was like, okay, I'm going to book stuff online, or I'm going to research trips that I can take when my kids are a little bit older. Right. So just finding some way to like keep in touch with the things that you feel like make you, right? The interests that you have, or so on. If you're partnered, it can be helpful to schedule your relationship too. And what I mean by that is it's kind of easy to get lost in the chaos of new motherhood, right? Hard to connect with your partner with the baby around, especially
oh my God,
in a
Nina, I have to send Google. Yeah. I have to send Google invites to my husband for him to put on his calendar.
I love it. That is awesome, right? Then you're on there, right? You have that time, you're prioritizing it. Google invites are perfect here, right? So making a plan, even if it's just a tiny plan, like a Wednesday night TV on the couch, right? Like Google invite that, like set it up, know that you guys are both in. So you can go a really long way. There are a million lists of what to do. I'm telling you what to do. Allison's telling you what to do. Liz is telling you what to do. Everyone in the entire world will tell you what to do as a mother, right? But there are so many pieces of advice that are not going to fit for you or for your baby. And ultimately, motherhood is about learning to listen to your own instincts about what you and your family actually need. Right? So it is okay to trust your gut. It is okay to block out noise or things that make you feel like shit as a mom, right? So paying attention to like how things impact you and being selective about what comes in the door is really important. Finally, if and when you find yourself struggling, you are not alone, right? Get help. Find new mom support groups. There's an organization called Postpartum Support International that has online groups for moms that are available they have so many that are available at different times in different time zones. Obviously, one-to-one therapy medication can be helpful in some situations. So make a point of reaching out. Your OB is a great starting point. Obviously, we're here and happy to be helpful too, but no matter where you're connected in with postpartum services, whether it's OB, whether it's PT, whether it's diet and nutrition, say something about how you're feeling emotionally, because people will have resources and ideas for support. So be vocal about it. Don't be ashamed. Everyone is struggling.
Oh, that's such wise words. I know we have just like a minute or two left, so I think we've got a bunch of Q&A before the event. So one that might be helpful, and Nina maybe, or Allison, this might be relevant for you, is we got a question about just how to improve postpartum brain fog. I imagine there's probably some like mental, maybe even physical things, Liz, but definitely probably some nutrition things in there, Allison.
Yeah, I definitely see it related to a few things that I think we covered in the nutrition piece. Like when I see a lot of brain fog come up when we're just undereating protein, undereating carbs, undereating fat, what have you. So by following the kind of 3 square meals that are bigger, I do think that resolves quite a bit of it. Hormonally, there's a big connection there too. When cortisol is high or low, actually particularly low, we talk a lot about high cortisol, but there's a lot of occasions of low cortisol as well. Brain fog tends to kind of can come along with that. And when the progesterone low can also cause some brain fog. So really, I think it is improved by working on the nutrient piece and the irregular meal piece. A lot of the brain fog can be resolved. And if it doesn't, then we want to maybe do a little bit more testing to see if there's some nutrient deficiencies that are related to that. We need so many for cognition and brain health. So some of that can just be depending on what's going on with the individual person and the hormone connection as well. But I see a lot of it just related to undereating in general, and we're not getting the right energy at the right time. And it's causing some cognition stuff going on. And Nina, some might be related to.
I was going to ask Nina if there were any exercises you could do like mentally for brain fog. I found myself just mostly trying to cope. Like I couldn't remember every patient I had seen that day and chart all of their notes. And instead I started just writing everything down on a sheet of paper to make sure I had it. But I wish that I would have actually maybe had some mental exercises I could do to help myself out of it.
Yeah. No, I mean, I think a couple of thoughts about that. I mean, one, just to speak to Allison's point, I mean, I think the brain fog it's foundational, right? So it's nutrition, it's sleep, for example, is the other piece, right? So if there are ways to shift those pieces, maybe it's getting a night doula or developing a better sleep plan with your partner, right? That you're on shift for this part, he's on shift for this part, or she is on shift for this part. In those moments that you're experiencing brain fog, I mean, I really like that, Liz. I think it's a question of a couple of things. I mean, one, I would stop, I would take a break if it's possible, right? I would step outside, I would take a few deep breaths. There are mindfulness-based strategies that you can use to try to refocus your attention. One of my favorites is one that's just, we call contact points, and it's just focusing your attention on somewhere that your body is in contact with something else. So that might be the floor under your feet and noticing and observing those sensations. It might be your butt in the chair or the chair against your back, right? Like, what do you notice? What does that feel like? You can use similar mindfulness strategies about like things that you can hear, right? 5 things you can hear, 5 things you can see, 5 things you could smell, right? Just as a way to kind of ground yourself in this moment and try to step outside of that brain fog. And I think largely it's a question of self-compassion and finding hacks, right? Knowing that this is a normal experience, right? You may be able to make some traction with it in the moment. And kind of like you, Liz, when I was at the end of my pregnancy and early postpartum, I was diligently taking notes, even in the context of a session, because I would think, oh, I want to say this. And if I didn't actually say it in that moment, boom, go
100%, 100%.
Right? Yeah. So it is what it is, right? Like you are one of like millions of moms across the world having brain fog. And if you can kind of view it in that perspective as like part of this process, right? Like it's coming, it's going, it is not a permanent thing. Find things to, ways to work around it in the moment and know that it will be gone. That's probably the best that you can do.
Awesome. Well, thank you, Nina, Allison, and Liz, so much for joining us, and for all of our attendees. Hopefully this was really helpful. We'll send out a recap of this event with the video as well, in case you want to review these slides or get any pointers, and with resources and links for Allison and Nina's practices. So thank you everyone so much for joining us. It was so wonderful to have you.